According to the American Heart Association, there's a heart attack in the United States every 60 seconds. In addition to that, 1 in 3 deaths are related to heart failure. By 2030, scientists predict that the medical cost of cardiovascular disease is projected to increase by 100%. These statistics are staggering, but luckily, the Eleanor Mann School of Nursing has launched their Transitional Care project, in which students are able to go out into the community and help patients with congestive heart failure and reduce readmissions into the hospital.
The mission of the Transitional Care program is to provide education for congestive heart failure patients transitioning from the hospital back to their homes to make positive life changes. That way we can reduce readmissions and exacerbations of their disease process.
The Transitional Care Project is a collaboration between University of Arkansas, Washington Regional Medical Center, and Walker Heart Institute. Faculty supervised teams of nursing, social work, exercise physiology, and nutrition students work closely with the providers at Walker Heart to provide follow-up care to patients with heart failure. Senior nursing students are assigned 1 to 3 patients to visit every week. Visits include a physical and functional assessment, a medication check, and low-sodium diet education. Walker Heart providers are available by phone to deal with urgent problems. Each patient will also have a social worker consultation, and exercise physiology and nutrition students will visit patients upon request. Team members participate in weekly interdisciplinary conference with providers from Walker Heart.
Delivery of healthcare is often fragmented and uncoordinated, resulting in decreased quality and patient safety, and leading to costly and ultimately preventable readmissions. Preventable readmissions cost nearly $17 billion in Medicare payments. 1/5 of Medicare beneficiaries with heart failure are readmitted within 30 days, and more than 1/3 in 90 days. Not only is this costly, but it takes a toll on the patient. Dealing with frequent hospital stays, ER visits, and disease exacerbations takes much from the patient's quality of life.
Transitional care programs like ours are being implemented all over the U.S. and the world. Not only is this program so beneficial to our learning as future nurses, but it positively affects our patients and the healthcare system. In a study done in 2015 of a transitional care program, there was about a 52% reduction rate in hospital readmissions and about a 48% reduction rate in emergency room visits at 3 and 6 months. In our pilot study of 17 patients, complex medication discrepancies were noted in 41%. 76% of the patients reported not understanding a low-sodium diet, and the 30-day readmission rate for these patients was 6% compared to the national average of 20 to 25%.
Since joining this program, it has been a really eye-opening experience on just how much our patients need us, whether it's in the hospital or home setting. During one of my home visits, I was able to perform a head-to-toe assessment on a patient with chronic heart failure. Through my assessment skills and collaboration among interdisciplinary teams, it was deemed that this patient was in dire need of immediate medical attention. Through its quick hospitalization as well as quick diagnostic studies, we were able to prevent serious complications of this patient's disease process. Had we not been there for our weekly visits, this patient could have easily been overlooked, and his disease process could have worsened until he was in critical condition.
One of the biggest factors in increasing patients' quality of life is their compliance to the treatment plan. In this program, we have started using a new interview style called motivational interviewing. By using motivational interviewing, we can combat ambivalence about changing our patients' behavior by empowering patients to take charge of their own health and lifestyle choices.
One of my patients was extremely ambivalent about making lifestyle changes, so I used my motivational interviewing skills to help break down her goals into smaller, more attainable goals. Together, we made the decision for her to help decrease her fluid on a weekly basis. She's met this goal, and I am extremely proud of her. I used my motivational interviewing skills to empower her to make this decision on her own.
It's easy to see the effect that this program has on our patients by what they tell us. For example, one of my patients at the beginning of this program was depressed and unmotivated. Towards the end of our program, he's actually requested that we do some of his visits while we're taking laps around the lake outside of his house. This is a huge milestone for him, considering he wasn't motivated to walk even to his front door a couple weeks ago and wasn't motivated to have a healthy diet. Now, he's excited to tell us about all of the new recipes he is trying, and he's very motivated. He even has told us multiple times that us going out to visit him weekly is his favorite part of every single week, and now he greets us at the door every time. It's encouraging to see the status that can change whenever we invest ourselves in these patients' lives, and it's encouraging to me to be able to check off on my skills and know that I'm making a difference in my patients' lives.
As a student participant of the Transitional Care program, I was allowed to gain a sense of autonomy that a clinical and a typical acute care setting would not have allowed. For the first time, I was able to practice my RN skills independent of an RN preceptor. I performed comprehensive assessments on my patients and was able to grow in my knowledge of the congestive heart failure disease and the types of treatment that these patients require. The amount of trust that was placed in myself as a nursing student allowed me to gain a sense of confidence and personal accountability that will help me as I begin my first career as an RN in just a few months.
This project has offered us a way to provide resources and services for each patient locally for them, and it's also working with the interdisciplinary team has allowed us to work cooperatively with other disciplines and help us become practice ready, as well as providing a holistic treatment regimen for the patients, and the patients have given positive feedback regarding the support from various disciplines.
We have seen this program benefit our patients greatly. The patients love the social interaction with the students, and we have been able to have a deeper assessment that we would not have been able to discover had the students not been in their home. The students have also been able to help us prevent hospitalizations by detecting signs and symptoms of decompensation and then communicating with us quickly to keep the patient stable. Medication management has been done, and then lastly, education has been tailored to each patient's needs.
It is our hope that through this video, you are able to recognize the importance and value of the Transitional Care Project. Through this study, we have been able to help save lives and improve quality of life while getting to experience autonomy like no other experience in nursing school. The Transitional Care Project addresses the patient, the nursing student, and other disciplines, and benefits the cost of the healthcare system. Through this study, individuals will be better citizens of their own healthcare through our education. The Transitional Care Project and the multi-level benefits of the program are unmatched, and we hope to acquire your support in continuing this study. Thank you.